Hey everyone, and a massive welcome back to the MediByte channel. I'm absolutely thrilled you're tuning in today, because we're tackling a highly requested and frankly incredibly important topic. Today's explainer is all about pelvic inflammatory disease, or as we usually call it, PID. We're going to completely unpack what this condition is, why it happens, and exactly how we manage it in the medical field. Let's get right into it. Okay, let's dive into this and map out our patient's medical journey together. We'll start with what PID actually is, then uncover the causes and risk factors, learn how to spot the symptoms, and understand the potential complications. Finally, we'll cover diagnosis, treatment, and the crucial next steps for prevention. Section 1. What is PID? So, as a healthcare professional here at MediByte, I want to make sure we're all crystal clear on exactly how PID impacts the body. Put simply, pelvic inflammatory disease is an infection that specifically strikes the upper female reproductive organs. We're talking about the cervix, the narrow lower part of the uterus, along with the uterus itself, the fallopian tubes, and the ovaries. And depending on where the infection actually settles, it causes very specific conditions. Like if it inflames the cervix, we call that cervicitis. If it hits the fallopian tubes, it's salpingitis. PID can honestly just be one of these or a whole combination of them at the exact same time. Now, it's super important to understand the physical chain of infection here. Basically, think of it as a journey moving upward. Step 1, bacteria first enter the lower reproductive tract, specifically the vagina. Step 2, if that's left unchecked, the bacteria spreads right up to the cervix. And finally, in step 3, the infection continues its upward climb, pushing into the normally sterile environment of the uterus, the fallopian tubes, and the ovaries. That upward spread, that is exactly what triggers PID. Section 2. Causes and risk factors.
So the crucial point is that PID rarely affects girls before their first menstrual period, and honestly, it's pretty rare in women after menopause or during pregnancy. Instead, it primarily targets sexually active women. The big risk factors include being sexually active and under the age of 35, having multiple or new sex partners, and of course, having sex without a condom. But there are other major risks too, like douching, having had a previous episode of PID, or dealing with bacterial vaginosis, which is a condition that basically just disrupts the normal healthy bacteria in the reproductive tract.
Now, when we look at the culprits, there are three main types of bacteria behind these infections. PID is most commonly caused by bacteria transmitted during sex, and the big three are Neisseria gonorrhea, which causes gonorrhea, Chlamydia trachomatis, causing chlamydia, and Mycoplasma genitalium. These bacteria are literally experts at making that upward journey from the cervix deep into the pelvic organs. Now, what's really interesting about this is a pretty staggering statistic. Roughly 1/3 of women who have had pelvic inflammatory disease will actually develop the infection again in the future. That massive recurrence rate shows exactly why understanding this condition, getting properly treated, and taking real preventative steps is absolutely vital for your long-term health.
Section 3. Spotting the symptoms.
Symptoms usually begin pretty subtly, often popping up right toward the end of a menstrual period or in the few days just after. Early warning signs can include things like a mild to moderate ache in the lower abdomen, some irregular vaginal bleeding, and an abnormal discharge that might have a pretty bad odor. But as the infection spreads, things escalate incredibly quickly. Later, severe symptoms include a high fever, a yellow-green pus-like discharge, really intense pain during sex or urination, and even vomiting. You absolutely cannot ignore those initial mild signs. Section 4. Understanding the complications. If left untreated, the complications of PID can be, frankly, devastating. Take peritonitis, for example. That's a highly dangerous infection of the membrane lining your entire abdominal cavity. Then there's Fitzhugh-Curtis syndrome. This one is wild. It's a serious condition where a chlamydia or gonorrhea infection actually spreads all the way up to the tissue surrounding the liver. It causes sharp pain in the upper right side of your abdomen and can actually mimic a gallbladder attack, which is crazy. Finally, we often see adhesions. These are abnormal bands of scar tissue forming between organs because of all that inflammatory pus, and they cause severe chronic pelvic pain. Another major complication is the formation of an abscess, which happens in about 15% of women with infected fallopian tubes. An abscess is basically a really painful collection of pus. Now, if this abscess ruptures, that pus spills directly into the pelvic cavity. Let me be clear, this is a true medical emergency. It leads to a sudden drop in blood pressure, life-threatening shock, and sepsis. And this brilliantly highlights one of the most tragic outcomes. Because of the severe damage and scarring to the fallopian tubes, a tubal or ectopic pregnancy is 6 to 10 times more likely to happen in women who have had PID. This is a life-threatening situation where the fetus starts growing in the narrow tube instead of the uterus. Because of this scarring, PID is actually the single most common preventable cause of infertility in the United States.
Section 5. Diagnosis and treatment.
So, if we're walking through the diagnostic journey in a clinic, a doctor is going to start with a physical pelvic exam. Substantial pain during this exam, that's a major red flag for PID. They'll also take swabs directly from the cervix to test for gonorrhea and chlamydia. Often, they'll use a pelvic ultrasound to spot any dangerous abscesses or rule out a tubal pregnancy, which is exactly why a pregnancy test is standard protocol here. If things are still a bit uncertain, they might even use a laparoscopy, which means inserting a tiny viewing tube through the navel to get a direct look at the pelvic organs. Once diagnosed, the primary treatment plan is swift and it is aggressive. Prompt treatment with antibiotics, usually given by mouth or sometimes through an injection, is absolutely required to stop those long-term complications we just talked about. And here's a vital rule. All sexual activity must completely stop until a doctor confirms the infection is 100% eliminated. Plus, all recent sex partners must be tested and treated. If you only treat the patient and ignore their partner, the infection is just going to bounce right back.
Now, while most women can be treated effectively at home, there are specific scenarios where staying in the hospital is mandatory. A patient needs hospital care if their symptoms don't improve within 72 hours of starting medication, if they're spiking a terribly high fever, if they might be pregnant, or if a ruptured abscess is suspected. Also, if severe vomiting means they literally can't keep their oral antibiotics down, they have to be admitted to get IV antibiotics or even have emergency surgery to drain an abscess.
Section 6. Prevention and next steps.
The most effective preventative measures are completely rooted in safer sex practices. That means correct, consistent condom use every single time. It also means getting regular STI testing if you're in an at-risk group. And crucially, you absolutely must avoid douching. Douching is actively harmful to your vaginal health. It washes away your body's natural protective bacteria and lowers your vaginal acidity, which basically rolls out the red carpet for those harmful PID-causing bacteria.
Let's move to our final thought. How can taking control of our reproductive health awareness today actually protect our future? Well, by understanding conditions like PID, spotting those early symptoms, and really prioritizing prevention, we actively safeguard our long-term health and fertility. Thank you so much for joining me for this MediByte explainer. If you found this information helpful, please take a quick second to like this explainer, share it with someone who might benefit, and subscribe to the MediByte channel for more incredibly important health breakdowns. Stay informed, stay healthy, and I'll catch you in the next one.